Hey guys, Dr. Berg here. I'm doing this webinar on how to basically understand what symptoms mean and evaluating your body's symptoms based on what your body's trying to tell you. Now, this is pre-recorded because the last webinar I did, the slides weren't synced to my video. So basically, I was over here, but you're like 3 slides behind. So I want to just create a video that works so you can follow along. Okay, so I'm going to give you a lot of very cool insights into what certain symptoms mean, because the problem in healthcare is there's the management of symptoms. There's no real understanding of what symptoms mean and what you should do about them. So we're going to take it one step deeper, look at the cause and effect relationships so you could kind of spot something and know what's behind it. And it's all related to nutrition. And we're going to look at more visual things versus like sensations, like let's say fatigue or that type of thing, or depression. We're going to look at skin, nails, hair, lips. Like if you can look at either someone or yourself and identify certain problems, I'm going to teach you what's behind it. Okay, so let's get started. Let me just go right into the slides. Okay, evaluating your nutritional deficiencies. Now, the first thing I'm going to cover is a little bit on the nails. So we have, if you ever look at either your nail or someone else's nail, a lot of things can go wrong with the nail. Number one, you can have horizontal ridges. That's a B1 deficiency, vitamin B1 deficiency. So if you have these ridges that go horizontal, you need B1. Now, vitamin B1, by the way, is the first B vitamin that was ever discovered in the B family. And then it goes vitamin B2 and 3 and 4 and 5 and 6. In fact, the first vitamin that was ever discovered was vitamin A, and then B, then C, then D, and then E. That was my dry sense of humor. But that's true. That's how they developed these or discovered these vitamins. But B1 is the first B vitamin that they discovered, and basically it creates a series of problems. But the nail is a good way to identify if you're deficient in B1. All right. So horizontal ridges. All right. Now, there's a couple other deficiencies that occur with B1. One is cyanosis. And what is cyanosis? Basically, cyanosis means that your circulation of your nail. So let me just show you a picture of that. You got these white nail beds. So if you ever look at people and they just completely look way too white, that is a B1 deficiency because vitamin B1 is involved in circulation. So it's kind of a white nail. Also, you can have an enlarged heart on the right side of your heart. You have the left and right side of the heart. The right side of the heart is influenced by B1. And so when you're deficient, the heart starts to get weaker and it starts to enlarge or atrophy, and it shows up as something bigger on an x-ray. Like you'll see an enlarged heart. That's cardiomegaly. That's really a B1 deficiency. So the B vitamins are intimately involved in the heart function. The other thing is that you'll have problems with the eye muscles. You ever see people where they have like wandering eyes, or they're cross-eyed, whatever? That is a weakness within the nerves to the eye, primarily the 6th cranial nerve, and that's also influenced by B1. Okay, B1 deficiency can also cause edema in your ankles. So if you ever see people like let's say you press into the ankle and it leaves a dent, that's a B1 deficiency. Okay. Now, a lot of times people will wonder, how do I get a B vitamin deficiency? How do I get a B1 deficiency? Normally, the history of this was involved with people consuming too much polished rice. That's basically refined rice, where they take all the nutrition out of the whole rice, and they basically have this refined white rice, creating a B1 deficiency. So, and the same thing happens with grains. If you have this whole grain with all these B vitamins, and then you strip it down, you refine it, you turn it into flour, white flour, and then they bleach it, you're going to create a problem with B1 and the other B vitamins, and that's why they enriched flour with synthetic vitamins. You'll see this flour is enriched, okay, but it's really enriched with synthetic vitamins. It's not the real thing. So B1 and other B vitamin deficiencies are created by consuming too much refined food, specifically the grains, white rice, flour, as in bread, pasta, cereal, crackers, biscuits, waffles, pancakes, even white sugar. Okay, so that's how you create a B1 deficiency. And just from a subjective symptom of B1 deficiency, you're going to have a lot of nervous tension. Like you're going to have worry, you're going to have anxiety, you're going to have a lot of this buildup of stress, low tolerance to stress. That's a B1 deficiency. I mean, how many people have that? So stress can deplete the B vitamins, and so can sugar, and so can refined foods. Okay? Okay, let's talk about brittle nails. Now, brittle nails, typically people, a lot of women, they get their nails done and they keep putting surface shellac on it and nail polish, and they try to strengthen the nails, and they do all these things to try to fix the nail. But if I was doing nail, I could actually identify brittle nails very easily by determining the nutritional deficiency, fixing that, and helping the person correct the real problem versus just filing it down. But brittle nails is usually another B vitamin deficiency, specifically biotin, which has another name for vitamin H. But biotin will create brittle nails because biotin is involved with the strengthening of proteins, amino acids, and collagen. That's why it's really good for hair. But if you take too much of biotin over time, it can create a problem with causing deficiencies of other vitamins, and people can get acne. So I like to look at the whole picture and not just try to fix a vitamin, but find out why you're deficient in a certain vitamin. You know, it has to do with your diet. Now, how do you become deficient in biotin? Well, several ways. Number one, you can eat a lot of raw egg whites. Okay, like when people put raw eggs in their shakes and things, that can create a biotin deficiency. Another way would be to eat a lot of refined foods. Another way, which is connected with your gut, see, certain friendly bacteria in your gut make biotin. So a lot of people that are deficient in biotin have an imbalance in their digestive system. So they need a good probiotic to build up that biotin. Okay? So those are some of the things that that can happen. Another thing with biotin deficiency would be the cuticle. You get all this peeling on your cuticle. That's a biotin deficiency. And one good source of biotin is nutritional yeast. Okay, you can get it from Amazon. I would personally recommend going to Amazon and getting the non-fortified nutritional yeast, which basically is without synthetics. A lot of times nutritional yeast, they enrich it with synthetics, which is, it is a problem, but it's a minor problem because naturally nutritional yeast has a lot of natural B vitamins, so it's not just all synthetic, so it's less of a problem if you have a combination. But I mean, if you're going to get it from Amazon, might as well get the non-fortified 100% natural B vitamins. Now, why don't they sell natural B vitamins in a pill? It's very rare to find it. It's very expensive. For example, if they were to make biotin in a pill, in a supplement, it's roughly about $800 a kilogram, which is 2.2 pounds. I think it's 2.5 or 2.2 pounds. That's $800, right? If you were to buy it synthetically, it's like maybe $9 or $10 per kilogram. So all these vitamin manufacturing companies are not giving you the natural version. They're giving you a synthetic, which come with problems down the road if you take too much of it or too long of a period of time. I'm okay with taking synthetic vitamins if they're for a detox, but any other reason, I don't like them. So how do you know if it's natural or not? You have to look at the source of where they get the vitamin. Um, and anything that's like over, like if it says like 6,000% times the normal value, or even 1,000 times normal on the back of the label, you know it's synthetic, because you can't put that much natural vitamin in a pill. So that's why you're seeing all these synthetic vitamins nowadays. But anyway, biotin deficiency can create a lot of problems with your nails, hair, and definitely the cuticle. And this is, it keeps the nail shop in business. All right, let's go on to the next one. Vitamin B6 deficiency. It creates a redness around the nose, the cheeks, and even the top of the forehead. This is a B6 deficiency. You can call it rosacea, whatever. You can call it psoriasis. It's just a redness around that the nose area and on the nose as well. So it's interesting. The B vitamins create a lot of skin problems and a lot of digestive problems, and a lot of hair and nail problems. So you'll see as we go along. So that's the B6 deficiency. Again, where do you get B6? B6 is actually easy to get from most foods. It's in eggs, it's in vegetables, it's in a lot of different foods. But it's usually the foods that, the junk food that pulls it out, like refined carbohydrates, breads, pasta, cereal, crackers, biscuits, waffles, pancakes. That's what's pulling it out. And yes, it could be an allergy to gluten and things like that. But, I mean, so many people are living on refined foods. This is what's causing it. Okay, a zinc deficiency will create those little white little specks on the nail. But the nail grows every 6 months. So if you see a white speck, let's say in the middle of the nail, that's like 3 months ago you created that white speck. Now if we're looking at the nail right here, it's probably, if we divide this nail by 6, it's probably like maybe 2 months, 20% of the nail, 2 months ago. There's a zinc deficiency that was created. Now, what causes a zinc deficiency? Eating a lot of refined carbohydrate, like in sugar. So we can pretty much tell about 2 months ago, they had a birthday party and they ate the whole cake by this white speck on their nail. So they ate a lot of carbohydrate. And I do this to people and they kind of freak out and they're like, how did you know that? Well, because I'm actually reading and interpreting what your body is trying to tell me. I understand the language. And this is what we're trying to do in this webinar, is to teach you how to read your body. Okay, that's a zinc deficiency, but it's really a sugar deficiency. The trace minerals, which is like zinc, which basically trace minerals are minerals needed in smaller amounts, like selenium, iodine, zinc, molybdenum, things like that, versus the bigger minerals like calcium, magnesium, sodium, potassium, needed in larger amounts. But we need the small trace minerals. Most people that I run into are deficient in trace minerals because the trace minerals are no longer in the soils, unless you get food from places that have volcanic soils. I was in Grenada, which is an island, which is basically, they grow this chocolate, this cocoa bean, and they have, the soils are so rich with these these minerals from the volcano, that it gives incredible flavor to the cocoa bean. And Switzerland and Belgium get their chocolate from the island, or they get it from Africa. The same deal. In Africa, they have the volcanic ash, and the soil's rich, and it gives the flavor of the food. And I tell you, I believe that a lot of people that can live in the areas where they had volcanic ash in the soils, they don't seem to gain weight that much, even if they eat, whatever they eat. They also have good bone structure. They don't have a lot of problems with their dental structure. So it's hard to find these trace minerals nowadays. But that's a zinc deficiency. Thyroid. Thyroid problem will create vertical ridges up and down. So that's a classic symptom, vertical ridges. The thyroid will also create a lot of other things like loss of collagen in the back of the arm, so will the adrenal, and also it creates problems with hair loss, and it will create issues with bags beneath the eyes, and a loss of the eyebrow on the outer part. So these are just little things that you can look at if you're trying to identify yourself. And again, I like to look at the whole body and not just take one little symptom and say you have this deficiency. I look at all of the symptoms. And for those of you that, as we go through this, want to know like what foods are high in certain nutrients, I'm going to share a download little button link below that you can download all these deficiencies, like basically where to get zinc, what foods are high in vitamin A, etc. So I'll give you that data when we're done. Okay, here's a condition, inflammation in the mouth and the lips. There are little ulcers on the lip, you'll see them, or skin rashes and things like that. And then there's another condition which is inflammation in the corner or angles of someone's mouth, called angular chelosis or cheilitis. And you see that a lot in kids or even in adults, where you have this little cracking on the corners of the mouth. This is the vitamin B2 deficiency, riboflavin. Personally, I used to have this growing up. Of course, I lived on refined foods. So definitely it's a B2 deficiency. Again, where do you get B2? It's in nutritional yeast. And it's basically what you have to do to avoid having a deficiency of it by avoiding the sugars and the refined carbohydrates and all that. So let's go on to the next one. B3 deficiency, vitamin B3 deficiency. It's called pellagra. Now, what is that? There's a condition called glove and stocking lesions where you have this severe, scaly, red, irritated skin on the hands and the feet. That's a very severe B3 deficiency. Okay, so if you ever see it, that's what it means. But look what causes pellagra. Consuming too much corn or consuming too much alcohol. Because corn is not very nutrient dense, and that can create a deficiency, especially the corn that people eat nowadays. It's GMO, it's the corn syrup and all that crap. Okay, B2 deficiency, riboflavin. Here's another one. Bloodshot eyes. That's a B2 deficiency. Jaundice. Now, what is jaundice? Jaundice is a backup of the liver into the bloodstream, where you have a liver problem, and your whites of your eyes are gonna get yellow. Your skin will be tainted yellow. This is a congested gallbladder or a congested liver. Now, if someone consumes, let's say they consume a lot of carrot juice, for example, they will turn yellow eventually, or kind of an orange. That's not jaundice. That's just a pigment that's coming out. It's not a problem. It's not a serious problem. It just means that you're doing too much carrot juice. And again, carrot juice is just way too much sugar. We don't want to do that. I used to do a lot of carrot juice. I thought it was good for me, but it basically started creating blood sugar problems because there's so much concentration sugar. Even though there's vitamins in it, it's still very, very unhealthy. Okay, so eating the whole carrot is better. Okay, let me just go back to these slides. Okay, jaundice, vitamin A deficiency. Now, vitamin A is almost like a hormone, just like vitamin D. It's a fat-soluble vitamin. It can go into the DNA of your cells. It can determine what cells turn into. Like, if there's a problem with vitamin A, you'll have this weird growth on your skin, on the eye, and you can even have like a white little shell or pigment right over the black part of your eye, the iris. So you can also have these little growths on the whites of the eye as well. So it doesn't have to be right over the eye; it could be on the side or the inside or the outside. That's a vitamin A deficiency. So anything to do with skin or acne, I always go to vitamin A. But what foods are high in vitamin A? You say vegetables. Yes, it's true, but all vegetables, like especially like kale, have tremendous vitamin A amounts. Like even with spinach, it's like 30,000 IUs of vitamin A. But that's all a pre-vitamin A. It's not the actual active form of retinol, which is vitamin A that you can use. So it has to be converted into the body. And with some people, they can't convert it that well. Some people they can. But on average, you might convert 4%. So where do you get your vitamin A? From the fats, from the butter, from the oils, from the olive oil. But if your gallbladder and your liver is congested, you don't have the bile to break down the vitamin A. So a lot of vitamin A deficiencies come from a problem with the liver or the gallbladder. And especially like they don't have the gallbladder, they become deficient in vitamin A. So these are just kind of side notes. So you might take vitamin A and not see any change. But I've noticed that when people start eating healthier and they clean out the liver or they support the gallbladder, all of a sudden their skin gets really good and their acne goes away. That is because you're absorbing more vitamin A because you're getting more bile output. Bile is kind of like the detergent that dissolves the grease. Okay, one of the classic symptoms of vitamin A deficiency is night vision issues. You can't see at night. Everything comes blurry, especially if there's bright oncoming traffic lights. You'll have a problem with that. That's the vitamin A deficiency. Now, as you age and the liver gets more congested, you can even lose your vision. You notice like when you get in your 40s, 50s, like your vision is just so bad. That could be a vitamin A deficiency as well. But it's really a liver problem. Okay? Okay, next slide. Here's another vitamin A deficiency. It's kind of like these little, if you ever like buy some chicken, look at the skin, you see those little follicles, they're little red little bumps on the skin. That, and if you have that like on your skin or behind the arm, that's a vitamin A deficiency. I'm telling you, anything involved with skin is usually connected to vitamin A. So far, we have 3 main deficiencies that most people have a problem with that involve the skin, the hair, the nails. So, which is basically like protein. You have the fat-soluble vitamins, the trace minerals, and the B vitamins. Those are the ones that always show deficient in a lot of people. Here's another B2, B3 deficiency, cracked corners of your heel, like your heels get really, really dry. That's a B2, B3 deficiency. So if you put lotion on that thing, you're just treating the symptom. But it's interesting, you go to a medical doctor, you go to the dermatologist, which they have in every corner in Florida. I mean, I went down there, I'm like, wow, they have so many dermatologists, and all they're doing is they're giving you cortisone creams for everything, for skin problems, doing biopsies, but they're not even getting close to the root problem at all. Alopecia, okay, what is that? Alopecia is a biotin deficiency, could be adrenal problems, but it's usually a biotin deficiency. So you start getting these spots of loss of hair. But again, if your diet is fairly good, it's probably coming from your gut. You have some digestive problem. Maybe you had some antibiotics. Maybe you had some leaky gut issues. That could be coming from something in the past, and you've never got your digestion fixed. So you got to look at the whole picture here. Just taking biotin is not the answer. The answer is getting your whole diet corrected. Biotin is also good for male pattern baldness and also thinning hair. But let's just touch on male pattern baldness in females and men. A lot of times they'll say that's an androgen deficiency, but in reality, if that was true, why do men have male pattern baldness as they age when at the same time their androgens, their testosterone, is decreasing? How can that be? I mean, if androgens or testosterone, excessive amounts of estrogen, or I'm sorry, excessive amounts of testosterone cause male pattern baldness, it doesn't make sense because it decreases with age. Well, what happens, really, it's an estrogen excess that's converted to a powerful estrogen called DHT. So it's an estrogen problem, men and women. It's just converted. So if you have the right ratio to estrogen to testosterone, you won't have this problem. So, and just as a side note, if you have a problem with this, or if you're getting loss of hair in the head, or in a male body, you're getting prostate problems, a really good remedy to help kind of correct the ratios of estrogen to testosterone is something called stinging nettle root. So get some of that. That's really good for prostate and also male pattern baldness. And also, if you're just losing hair and you're a female, of course you don't have a prostate, go ahead and take it as well. Okay, iodine deficiency creates an enlarged thyroid in your neck, or goiters, or nodules in the thyroid. See, here's how, if you're, all these little cysts on the thyroid, on the breast, on the ovaries, come from excessive estrogen. But see, iodine protects the excess of estrogen, so it competes with estrogen. So if you're deficient iodine, estrogen can create a lot of damage to your body, especially a female body. So if you have a good amount of iodine in the diet from sea kelp, which I recommend, get the organic kind, because if you just get regular, you know, sea kelp from the store, it might be contaminated with arsenic. You want to get something from Iceland or something that's organic, that's really healthy. But here's the point. Iodine will actually decrease estrogen, and it actually is a good cancer preventer, and it actually handles cysts, nodules of the thyroid, of the breast, fibrocystic breast, of the ovary. Very, very important. The tongue, if it's a red tongue, that's a B2 deficiency. If it's a glossy red tongue, that's a B12 deficiency. A white tongue is a yeast overgrowth, okay? So that's a yeast imbalance. That's a gut problem. Fissures in the tongue, that's a B12 deficiency. It can happen like down the center on the sides. These are all B vitamin deficiencies. Now, you see the outer part of the eye, the eyebrow? It's like there's no hair there. That is a thyroid problem. And you know what's interesting about the thyroid is the thyroid blocks the absorption of nutrients in the body. So really, it's a nutrient deficiency, but the thyroid can create the nutritional deficiency. So again, you know, you need to understand how the whole body works. Now, this is a real common thing I see a lot of people. You see like a pink toothbrush, like you get bleeding gums, or red swollen gums. They call it gingivitis. That's a vitamin C deficiency. It's a form of scurvy because vitamin C strengthens the capillary beds. So anything like microhemorrhaging, like those varicose veins, spider veins, the little red cheeks, anything with vascular things like that, that's a vitamin C deficiency. But what's happening at the cellular level is that even in your arteries, you're getting little lesions of bleeding in the arteries, and that's when you have the accumulation of cholesterol as a band-aid and calcium as a band-aid in the arteries, and then you get a clogged artery. So these people that have gingivitis really they're developing problems in the vascular system as well. But if you brush your teeth and you get bleeding, that's a vitamin C deficiency. Do not take the synthetic vitamin C. Get it from the food, concentrated food. I use the wheatgrass juice powder myself, but you can get it from just a lot of vegetables as well. Versus orange juice has no vitamin C because it's pasteurized, but they put some synthetic in there. So don't take the synthetic. Now, if you have too much fluoride, which a lot of times in the water supply they use too much fluoride, that can create that discoloration in the tooth, and that creates an imbalance in calcium metabolism. So, I mean, it's like everyone's like so pro fluoride, but it's very toxic to your body actually. If you've been following me, you know about the body types. If you look on, someone has a heavier hips, that's an ovary type. If they have a sagging belly, that's adrenal type. If they're weight all over, that's a thyroid. If it's more of a protruding belly, that's a liver problem. Okay? So you can look on the outside of the body and determine what's going on the inside. Itchy foot on the bottom of the foot. That is a liver problem. It's a liver issue. Just want to let you know. Neuromas. What's a neuroma? It's a little nerve bundle on the bottom of the foot that can be very painful if they do surgery on it. That's a virus. And viruses come out of remission when your adrenals are weak. You can't kill a virus because a virus is not alive. Let me explain this. So viruses are very fascinating. They basically get activated and they get inactivated. They get activated by your own tissues. When you become tired, stressed out, burnt out, get older, the viruses come out of remission and they create all sorts of damage like shingles and herpes and all these other issues. But when you're healthy, they go back in remission. But the adrenals control if it's going out or in. So you can't kill a virus. Your only solution is to get healthy. But it's interesting because viruses usually come out when you go through stress. They're activated. Okay? Now, so here's what I'm going to recommend. I spent a lot of time creating an advanced evaluation questionnaire. It's kind of a free test. Someone can go on, and this is the URL, the address online that you can go to, that you can take this lengthy evaluation. And I want to explain exactly what the heck this thing is. I created this quiz a while ago, and it has 104 questions. It has every single symptom you could possibly imagine. And what I did in my spare time is I took every single symptom and I evaluated all of the potential causes of that one symptom. Then what I did is I created logic, so when you were to fill out this quiz, it associates with other symptoms. So it looks at other symptoms that you have and all of those potential causes to find the most likely cause, the number one cause of all of your symptoms, okay? So it actually thinks, and it's on automatic pilot, so you don't need a practitioner to tell you what it is. So what I did is I created this quiz, and then I kind of I wanted to not just evaluate and tell you what your problem is, but to help you understand and interpret what that means, and so you can have a greater, deeper background of the symptom and what you should be eating and what remedies would be good for you, both additional remedies like at the health food store or just general remedies, things like that, to actually not just treat symptoms, but we want to treat the cause of the symptom and correct it. Okay, so it's kind of like a training program as well as an evaluation software. Okay, then what I did is I created all the potential causes of problems like low vitamin B1, low fat soluble vitamins, low B2, low potassium, and I created all the symptoms that could occur from those causes. So when you take this quiz, it dissects everything and comes out with a really cool freaking report that you will love. Okay? So, and then I have all these different remedies that you can use to actually correct it. So, here's what I recommend that you do. Take the quiz. You go to drberg.com/evaluation, take the quiz. And it's not a short quiz, it's a long quiz. It's 104 questions. But it's awesome because it'll actually dissect everything. For those people that are under my membership site, they can take it every month, but I'm just letting you take it as a one-shot deal for free. Normally I'll charge for it because one of my health coaches will contact you, just kind of review it, and then send you the report. Okay, so just help you understand it. And then you can go through it at your leisure and just start to learn from it. Okay, so I think it's a very cool evaluation, and I'm going to allow you to take, one evaluation. And that is basically your next step. And let me just kind of put this up on the screen too. You'd go to drberg.com/evaluation, and you're basically going to just fill out the thing, and it might take us a day or two to get back to you because we're going to analyze it, look at it, and then contact you, walk you through it, take a couple minutes, and then what we'll do is we'll send you the report, and you will have a really cool assessment of what's going on to your whole body and the underlying deeper root problem that you need to focus on. Because my whole thing is this: stop treating symptoms. Let's treat the cause of it. Let's go deeper. Your results are dependent on getting the real problem, and so if people get results, then they can actually resolve a problem. And there's nothing worse, and I see this all the time with people basically treating symptoms, and they keep treating symptoms and they never get to the root of it, and they keep going and keep going, and they just get frustrated. So they go to the doctor, or this specialist. So this quiz is about an advanced evaluation technology. Evaluation means finding a root cause, understanding what the body's trying to tell you. Like even if you have pain, your body's trying to tell you, don't move, right? If you have pain when you eat something, what is your body trying to tell you? Avoid that food. So this is all about trying to understand what the language of the body is in interpreting symptoms, okay? So anyway, that's the quiz, and I wanted to share just some insights on that with going through the different assessments. But now you'll be able to look at someone 3 feet away and kind of spot what they're deficient in, which is good and bad, because you're going to probably now want to evaluate everyone you know. Just don't mention my name. I can just see you now, like, did you know I have a B2 deficiency? Yeah, maybe people might not accept that, but this is good for friends and family. So I hope you enjoyed this webinar. I hope you learned something, and your next step is to take the evaluation, and I appreciate your attention this far. You made it this far, and I will see you in the upcoming videos. So thank you very much, and I will see you soon.